my undergraduate degree, I decided to pursue geriatrics. I thought that that was something I wanted to do. I started accompanying my grandparents on their primary care visits, and it just was a field that I felt needed some improvement and could be done better. My senior year of college, my father was diagnosed with stage 4 lung cancer, and he died within 6 months. So we as a family really went through that process with him, and we saw really good care, and we saw really bad care. I entered medical school that following year, still thinking about geriatrics, still with that in mind, thinking I'd sort of skirt lung cancer because it was a little too close to home at the time. And I found that surgery was where I really had my home in the medical profession. And I went and I entered Rush. As I went through my rotations, rotating with the thoracic surgery service here, and once again, facing those lung cancer patients that were so very familiar to me, I sort of found that similar thread that I saw in geriatrics, that it is a field that has a lot of areas for improvement, that often lung cancer patients, there's a lot of shame associated with the diagnosis because of its association with cigarette smoking. And that was something I knew I could take care of those patients well, and I wanted to do that, and I wanted to do that and honor my dad. It's not just my job to deliver a diagnosis and give a treatment plan, but that there's a real whole component of caring and healing really with this, and making sure that I allow time for patients to tell their story, tell me who they are, really take time to listen to them, because there's a whole lot that goes into it that I think I have an advantage a little bit because I went through it. The common misperception is that there is little hope with a lung cancer diagnosis, and I want them to know that that's not true. You always have a team behind you, and Rush does that excellent here with our team, and I want them to know that they're never alone in the diagnosis. I commemorate Father's Day. We get vanilla fraps. I grew up in New England, in our New England version. So on his birthday and Father's Day, it's what he loved, so he would be tremendously proud.